Hello, everyone. I'm Dr. Rituja Waykole, and my topic is GNM and psoriasis. So, first, let's take an example. We'll start with the case. Uh, a lady came with her eruptions over arms since 2014 and 15. It started from both legs and then on arms. Type of eruptions are circular, crusty, itching, and it gets aggravated after bathing. Disease effect feels this should get cured very fast, does not want to go out and does not want people should see it, feels embarrassment. People ask, what is this? What has happened? But she does not like it. So, first of all, so for this, we'll study her nature history since childhood and will later on shift to her cause. In childhood, she was very happy-go-lucky girl. Her parents used to pamper her a lot. Parents gave her all the freedom. She had liberty of anything to wear, to go anywhere. Her grandmother was Orthodox. She used to not allow her to dance. She did not listen to her grandma. Just did what she wanted to do. Married in 2001. After that, too many restrictions. She was not allowed to go at her maternal place, not allowed to speak with neighbors, nor with her friends. Husband was very dominating, used to scold her. This got on piling up in her. Her children grew, and later on, she started to feel that this is not what I want. She wanted to take divorce from her husband, but looking to her children, she did not take it. Feels to go somewhere where she will get peace. So, according to GNM, the layer affected in psoriasis is epidermis. As you can see here, this upper layer is the epidermis, and it is controlled or it is formed from ectoderm and is controlled by cerebral cortex. The biological conflict behind it is related to separation conflict. It is experienced as a loss of physical contact. Newborns suffer the conflict when they are separated from the mother at birth. Like, for example, if they are kept into the incubator. A separation conflict can already occur intrauterine. For example, because of ultrasound procedures. The ultrasound noise drowns out the heartbeat of the baby, of the mother, which can be highly traumatic to the fetus. Each ultrasound test triggers a conflict relapse for the unborn. Now, this we have seen that it occurs in infants or intrauterine. When can children suffer this separation conflict? Like example, whenever children are scolded or whenever they are punished or they're abused. When a new sibling is born who gets very attention, when the parents are split up, when they are not allowed to see their friends, or when they have to get separated from their favorite doll or teddy bear, stuffed animal or pet, they like to cuddle. Also, when the mother goes back to work, when they are put into daycare, kindergarten, or to relatives, or when they are left with a sister or nanny. The elderly feel separated from the pack when they have to move into a nursing home or after the death of lifelong spouse or companion. The fear of losing touch or contact with someone, like example, threat of a divorce, long distance relationship or weekend relationship, the fear that a loved one might leave, move away or die, or feeling rejected by a person, let's say because of an disagreement, can evoke the conflict. Pets suffer separation conflict, for example, when their master leaves or dies, or when they are put in a kennel. Epidermis not just involves separation conflict, but it also involves wanting to separate. What does wanting to separate means? I no longer want to be in touch with someone. Means wanting to separate. Okay. The conflict refers to wanting to separate from a person, in the sense of wanting, but not being able to push someone away, literally or figuratively. For example, there's a terrorizing boss or a teacher, or an annoying colleague or a schoolmate or an abusive parent or spouse. Okay, whom the patient wants to move away or get away, but is not able to do so. So they will get psoriasis. So separation conflict also pertains to wanting to separate from something which is very close to skin. Like for example, a mask, oxygen mask, a helmet, hat, clothing, shoes, tight stockings, wet linen, wet diapers. The same applies to a separation from something that is some one is no longer allowed to or able to touch. Like for example, a musical instrument, like a child who is very much interested in playing guitar, but due to his academics or due to his study overload, his mother does not allow him to play guitar. So that can also be one of the separation conflict. Or it can be feel of the skin, like an engagement ring, a favorite pillow, something like that. Now, what happens in conflict active phase? So, during the conflict active phase, the epidermis ulcerates the area associated with the separation. So, there occurs an ulceration. The ulcerations are microscopic and usually go unnoticed. Hmm. With continued conflict activity, however, the skin becomes dry, rough, flaky, pale, and cold from poor blood circulation. Eventually, the skin begins to crack, causing fissures that may bleed. Because of the loss of epidermal cells, the sensitivity of the skin decreases. If the separation conflict is severe, the skin can become completely numb. Okay, so whenever the conflict is heated, there occurs an ulceration. If there is ongoing conflict activity, it will become dry, rough, flaky, and later on, cracks will develop. Healing phase. Now, what occurs in healing phase? During the first part of the healing phase, the ulcerated area of the skin is replenished through cell proliferation. Okay, so there occurs cell proliferation. The skin swells up, becomes red, inflamed, irritated, itchy, and sensitive to touch. The small fluid-filled edemas appear as blisters. After the epileptoid crisis in PCLB, the blisters dry up and the skin normalizes, provided there are no conflict relapses. So, in healing phase, first of all, the ulcer is replaced by cell proliferation in the PCLA, and in PCLB, a fluid fill blister is formed. So, this is our patient. This is her first photos. You can see the psoriasis, legs photos. This is the repetization sheet according to her cause. Like she wanted freedom. She cannot support anything that is going against. She's defiant, and her husband used to scold her a lot. And what she wanted is to go away from all this, wanted quietness. Medicine given was spongia. And this are the after videos. Photos. So you can see here a whole patch has been disappeared, like it is healing. And this one is the follow where you can see everything has gone. Thank you.